Coronavirus is an infectious disease that is caused by SARS-CoV-2. This disease has led to a global pandemic which has caused economic and social disruption. Most importantly, we have lost so many lives due to COVID-19. It has been found that having underlying medical comorbidities like diabetes, cardiovascular disease, hypertension, and more can make you more susceptible for the virus. Also, having these underlying comorbidities can cause the virus to be more severe compared to people who don't have these medical conditions. This has led us to reports of minority slash racial groups like African Americans, Hispanics, Native Americans dealing with the burden of COVID 19. So, today we are going to discuss the relationship between health disparities and COVID 19. So, throughout this presentation, we are going to discuss the scenario between Jordan, Anthony, and Nathan. Jordan is an African American male who's 30 years old. He's from Boston, Massachusetts. He has hypertension, he's pre diabetic, and also has a family history of chronic diseases. Anthony is Hispanic. He's 32 years old. He's obese and also has a family history of chronic diseases. Nathan is a white male who's 35 years old from Newton, Massachusetts, and has a couple family members with chronic diseases, but it's not anything too serious. So, between these three men, what are the differences? What are the similarities? Think about that. What are health disparities? Health disparities is when there's a health difference due to social, economic, and environmental factors. Many minority racial groups, like African Americans, Hispanics, and Native Americans, are negatively affected compared to their counterparts. In this photo, we see the diseases that kill the most people in each racial slash minority group. All of them all have a common disease, which is heart disease and cancer. But the way it affects people in these racial minority groups are different. Native Americans, Latino Americans, and African Americans are more likely to have a higher rate of those people who die of heart disease and cancer compared to white people, Asian Americans, and Pacific Islanders, which is due to social and economic factors, which we are about to get into. One of the socioeconomic and environmental factors is access to healthcare. Having access to healthcare is the ability to have adequate health services to get the best health outcome. African Americans and Hispanics are less likely to have access to healthcare. This is due to the fact that there is less clinics and hospitals in the neighborhoods that they live in. Also, their jobs may not provide that health coverage that is needed for them to have quality healthcare. This plays a role in their susceptibility to chronic diseases because they're not able to go to the doctors to check them out to see if they have certain diseases or not. And with COVID, there are less testing centers in these communities, so they're not able to get tested. If they're not able to get tested, they are not able to get treated. And if they're not able to get treated, they're more likely to spread it around their communities. Another factor is housing and neighborhood. Your environment has a huge effect on your health. In low income areas, there tends to be more African Americans and Hispanics, less access to healthy food options, less gyms and parks, and a high dense population. These all contribute into getting chronic diseases because if you're not able to eat healthy and be able to be active, then you're more likely to get chronic diseases. And with having a chronic diseases increases your susceptibility to COVID-19. And with living in a high dense population, you're able to pass it around to your neighbors, your friends, your family, which can increase the rate of COVID-19. In middle slash high income areas, there tends to be more white people, more access to healthy food options, more gyms and parks, and a less dense population. When you're able to have more gyms and have more healthy food options, it lessens your chance of getting chronic diseases, which lessens your chance of getting COVID-19. Also, being able to be apart from your neighbors and your friends and your family allows you to practice social distancing and avoid getting COVID-19. The last factor is income inequalities. In the United States, white workers earn 28% more than black workers and 35% more than Hispanic workers. Blacks and Hispanics are more likely to have service, transportation, and jobs in sales compared to whites. Minority groups may be at a greater risk of infection as workers in essential industries must continue to work despite the outbreaks in their communities or due to the economic situations. Workers without paid sick leave might be more likely to continue to work even when they are ill. Gaps in health benefit coverage may also result in workers being forced to go to work when ill. Back to the scenario. Did you find the similarities? Did you find the differences? Some of the similarities is that they're all male, 30 around the same age, from the same area, and do somewhat have a family history of chronic diseases. The differences are that Jordan and Anthony have a higher risk of developing these pre-existing conditions like diabetes, cardiovascular disease, and hypertension compared to Nathan, who's fairly healthy and barely has a family history of chronic diseases. So my question to you is who's most likely going to be negatively affected by COVID-19 and who's less likely going to be negatively affected by COVID-19? Now for the big picture. How are health disparities in COVID-19 related? The elderly, underrepresented minorities, and those with underlying medical conditions are at our greatest risk. The Western diet, which consists of high consumption of saturated fats, sugars, and refined carbohydrates consumptions, activates the innate immune system and impairs adaptive immunity, leading to chronic inflammation and impaired host defense against viruses. Furthermore, peripheral inflammation caused by COVID-19 may have long term consequences in those that recover, leading to chronic medical conditions such as dementia and neurodegenerative diseases, likely through neuroinflammatory mechanisms that can be compounded by an unhealthy diet. COVID-19 cases and race. This table is taken off the CDC website and it's comparing race and ethnicity with COVID-19 cases, hospitalization, and deaths, and we're comparing it to white non Hispanic persons. For cases, African Americans, Native Americans, and Hispanics have a higher rate of cases compared to Asian non Hispanic people. For hospitalization rates, Native Americans, African Americans, and Hispanics have a higher hospitalization rate compared to Asian non Hispanic people. For deaths, African Americans have a higher death than Native Americans and Hispanic Americans, and Asian and non Hispanic people have no increase. Back to the scenario. With all the information we have talked about, who will be negatively affected by COVID-19? If you guessed it, it was Jordan and Anthony. This is due to the fact that they're minorities, they're African American, and they're Hispanic. They are older, they have pre existing conditions, and they have a family history of chronic diseases. The person who won't be as negatively affected by COVID-19 is Nathan. That's due to the fact that he's healthy and he has less family members that have chronic diseases, and he's white. So, with all the information that we have gathered, what can we do to help people like Jordan and Anthony? And Nathan, too. One thing we can do is address minority/slash racial issues in the healthcare system. For centuries, minorities have been misrepresented, misinformed, disrespected under the healthcare system. And if we're able to address these issues and grow from them, we'll be able to change the healthcare system for the better and make it more comfortable and more available for underrepresented people. Another thing is eating healthier foods and increasing physical activity. Incorporating fruits and vegetables to your diet can decrease your chance of getting chronic diseases. Adding dietary fiber to your diet is very important. Benefits of dietary fiber are lowering cholesterol levels, helps control blood sugar levels, maintains bowel health, and helps with weight management. Foods that are high in fiber are whole grains, fruits, vegetables, nuts, and seeds, and more. Daily exercise can decrease your chance of getting chronic diseases. Lastly, is listening to the CDC guidelines, so being healthy, being clean, making sure you clean and disinfect your areas, social distance, and try to pick up and deliver from the grocery store or from the regular store as much as you can to avoid contracting COVID-19 and spreading it. So, I wanted to talk about my experience with the whole pandemic, and I just wanted to mention that this whole pandemic has really opened my eyes to a lot of things. I realized that a lot of the odds are against me because I'm black, I'm a female, and I do have a family history of chronic diseases. So it's definitely changed my lifestyle a lot. I have been working out, I've been eating better, but I also been educating myself about these issues within minority communities and just the world in general. And it's not only important for me to educate myself, but it's important for me to educate the people around me and making sure they're doing the right things for them to be healthy and prevent themselves from getting COVID and getting all these diseases. So I just wanted to mention that.